everybody. Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
Great, how are you?
Doing good.
Yeah.
So today we're talking about tooth loss and gum disease.
Yeah.
These are really, these can be scary for people. These can happen really easily, but they're very easily preventable. And you brought some cases to show us what can happen when you're not taking that preventative action.
This next picture that you see may look extreme, but it is what we see in our practices. Most every dentist that's practicing for at least a year or two will see this situation. These teeth were being held in by, we don't know, but I was able to grab with a piece of gauze and remove that entire 6-unit bridge, it's called, being supported by the 4 natural teeth with gauze. No Novocaine.
Wow.
And we stood it up on the screen, put a little picture together so you can see that. This patient in particular was terrified of coming to the dentist.
Yeah.
So the prevention could have occurred 20 years ago, but it finally came to the point where she noticed the teeth were loose. Was there anything we could do? And there was. We had to eliminate the source of the infection, which is the remaining teeth.
Oh, man. And so what is this picture here?
It shows the same thing on the lower teeth. Considerable amount of gum loss, and the gum loss is due to the bone loss. Bone supports the teeth. The gums are on top of that. So if the gum is low, the bone is low. When you have low bone, low gum, the teeth get loose. It's harder to clean. The bacteria are in there swimming in the kiddie pool, like we always refer to it.
Yeah.
And there's not a whole lot you can do. You can only manage gum disease. You cannot cure it. There's no cure for this.
And if it's not managed, it can lead to things like this.
It turns into this. If you manage it, managing means, we always tell someone like you, come in twice a year, Jackie.
Yeah.
You're young, you're healthy, no worries. You come in, you love coming to see your hygienist, right?
Love it.
But when you get to this situation, you're my age, 57, and your teeth are starting to loosen and the gums are gone, the bone is gone. We may say something like, Jackie, did you know you have gum problem? Did you know that you're losing jawbone? Did you know you're losing your gums? Yes, I did. Does it bleed when you brush? Yes, it does. Does it wiggle at all? Yes, it does. Well, we can manage this by having you come in either 3 or 4 times a year, along with oral rinses, some mouthwash that you use once a month for a week, and then fluoride rinses every night. And we don't have to pull your teeth with gauze and put them on the table and end up here talking about it.
No, we don't.
Okay.
And so you've got another really extreme and interesting case of someone that had a tooth infection develop, and it resulted in death.
It's sad. It's surprising that I don't have the statistical data that suggests that there are a lot of patients that are dying from tooth infection. Sometimes we don't know. But in this situation, Andy Hallett, a TV star of a TV show, Angel, and he played Lauren in there, if you're familiar with it. He had a tooth infection, and in between, jobs, he was out of work for a while. He thought he couldn't go to the dentist because he did not have dental insurance, and he was concerned about the costs, and we know how Hollywood could be with young actors. He was 28 at the time.
Very young.
The infection went throughout his entire body and affected and minimized his heart function. So he had a cardiomyopathy. He was on oxygen. He could barely move. It's a sad story. So at age 28, he was debilitated and passed away 5 years later. So at 33 years old, all he needed to do is maybe go in and see someone like myself. We take the tooth out, root canal, whatever it was.
If it removes the infection before it spreads, it's removed.
Then you're going to heal yourself, and maybe we'd be watching him in greater TV shows and movies. You don't know.
Yeah.
Unfortunate that it happened, but it's more common than we probably are aware.
It could, because it's so easy for that tooth infection to go that far when it's not taken care of and when you're not doing anything with it.
Your mouth is the opening of that highway throughout our body. We have 400 bacteria in our mouths that are not good for us.
Wow.
How we are able to take care of it, we have magnificent defense systems, but when the bacteria overtake because of an infection, your body can't handle that, and unfortunately something has to give.
Yeah. And that is, it is unfortunate. And not a lot of people think about the health of their health and their wellness, connected to their mouth and their teeth. But it's really important to make that connection, to know it's there.
Most of the time in our office, the correlation is 1-to-1. It's if you have a healthy dental wellness or oral environment, most of the time you're pretty healthy. And those patients that are cardiac patients, high blood pressure, diabetes, we strongly recommend that they come in 3 times a year, and if you're over 75, 4 times a year. Not everyone does that,
Yeah,
but it is a recommendation,
absolutely.
and it's in the research, so it's found to be the case to help people, and if you choose that. So the correlation of healthy gums is usually a healthy body.
Healthy gums, healthy body.
You know it.
So if you are having bleeding when you're brushing your teeth, if you're worried you might have gum disease, or if your teeth are feeling loose, get in to see a dentist as soon as possible. Schedule a consultation, just a time to meet. You can schedule appointments with Dr. Bilski right online. Visit him online at bilskidds.com. Thank you so much for talking to us about this important issue today.
Thank you. Pleasure.